Hi, welcome. This is Narrative Sand Therapy Conversations. My guest today is Sarah Hoops. She's got questions and our focus is going to be on symbols. We have other conversations coming up for you. I look forward to seeing you on all of those. But today, let's focus in on your questions. And there are so many places we can go with symbols, because it's not just for sand therapy, but it is for therapists, clinicians across the board, across the disciplines, who may want to be using different symbols with individuals, with families, with couples. So it's from 3 to 103. So Sarah, you came with some questions.
Yeah, I have a lot of good questions to ask about symbols. So let's start with, what is the role of symbols in narrative sand therapy?
What I'm struck about that question is the use of the word role, because it really hones in on the fact that symbols can be activated, that they do have a role, and that we treat them with respect as the third presence in the process. That symbols are the third presence in the room from a narrative point of view. So the role is how we imbue them, that they have their own backstory, that they have a relationship with the other symbols they may be clustered with. But for sure, symbols have a relationship with the client and with the therapist, which we forget sometimes. So then we go back to the idea of projection. What enlivens? What brings life? How do symbols come alive in the sand, or on the street corner, or in the classroom, group, whatever process? Yeah. So the role of symbols is to carry the story that the client brings. And that can be social, cultural, familial, but it's also the unconscious. It is memories that have been lost. It is the stories that have a difficulty being told because they have been threatened and judged. So symbols carry the very stories, the very traumas, emotions, and perceptions from that very 3-year-old to the 103-year-old. They carry these stories, and then we give them acknowledgement to be a part of the therapeutic process and to give voice.
Okay, so that's what symbol activation means, is
Sure.
when it becomes imbued with the meaning.
Yes. So symbols are, in the very beginning, in the baseline, they're objects. They're things. They're a toothbrush. They're a tree or a piece of fire. They're anything. And our brains evolved to find meaning. So when we see an object, we project meaning. And we do that, just as a footnote here, we do that with people, with others. So with partners, or with cultural others, with our way of being in the world. Now, Marie-Louise von Franz, a Jungian analyst, one of her emphasis is that we wouldn't be able to exist, to connect, to survive without projection. And so we create stories, fairy tales, human myths across the globe, history, everything that we share, all the sciences. Okay, so how then do we project onto the stone, the tree? That was grandmother's tree, or that's little Jeremy's truck that he brought into the garden. All of the ways that we anchor memory, that we anchor relationships, the wedding band, the birthday cake or candle, the solemn rituals that we bring to religions across the world. It's all symbolic because we imbue, we project meaning. And so we take the stories and we take these projections and we put them onto that which is the candelabra, the flame, the hearth, grandma's chair, yeah, Auntie's sewing machine, Uncle Harry's, those tools in the shed that never get touched. So it becomes emotional and meaningful and visceral and kinesthetic. And so in therapy, when we introduce and bring symbols, we give space and safety for the projection of the client and the meaning that they bring, not some prescribed meaning, not a tarot reading or an interpretation that's found in a book or on the internet or whatever source. The therapist becomes aware of what their projections are. What does the turtle mean to me? What did it mean in Hindu culture or in the in the Pacific Islands? What does it mean? That's all stored within the therapist to be mindful, to resonate, but not to interpret. So we give space in narrative sand therapy not to interpret, but rather welcoming and inviting. What is this? What does the turtle mean for you? What is the tree? How does it hold meaning for you? The swing that hangs from the tree. What is its meaning? And then, in process, what is the voice of the swing, the bridge, the tree, the turtle? What is it that they want to say to you and to the world?
And is that how then it becomes the third presence in the room along with the client and the therapist?
It becomes that living model of expressed emotion, of memory that has not been shared, of memory that's been lost, because our experiences, when they are traumatic, they need to go somewhere, and they get packed away. And so that's where they're kept safe until there's a moment, for example, in therapy or in a trusted other, in a love relationship, where sharing and trust exists. So in a therapeutic domain, symbols come alive because the client is given permission, protection, empowerment, and the full presence of the therapist to witness. And the activation of the therapist's body, the wholeness, depth of being present, to honor the symbol that showed up. And it's from that position that we take that invitation. What is this experience for you? If the turtle were to speak to you silently, what would it ask of you? Is there something that you would like to say to Turtle? Just share it in silence. Don't tell me. This is permission and protection. The activation, active imagination, is the activation of the imagination, which includes memory, perception, the stories, the narratives that are kept sacred. And so if the turtle's ready and if the turtle feels safe, it can share. And then I might say, and what would it like to tell the world? And the turtle then turns to the world. I wish there were more safety. I wish we had more connection. I wish I didn't have to be afraid. So that's how they come alive.
Yeah, beautiful. Yeah. And one of the things that you have brought in a lot is safety. Can you share a little bit more about the importance of safety specifically with symbol work?
Yes. So we hold these stories, our narratives, in safekeeping, sometimes for years, for decades. If we try to share that straight away, what happens in the head? Judgment, shame, humiliation, and the injunctions. You shouldn't feel that way. You shouldn't be thinking about that. You should let go. You should move along. You should change. That isn't right. That isn't, all these injunctions. So that restrains us. But when we're able to project, to gift the memory to the symbols, there is someone there, whether it be in the sand, on the street corner, on the table. That third presence is holding and witnessing. It's not safe to share that which has been humiliated, degraded, what has been stolen from us from an existential point of view. We exist, we are mortal. So how do we find meaning? And so core issues in existential, what is my identity? And how has that been stolen from me? How has that been deformed, distorted, defined by others? The power that has been ripped off, stolen, defined by social culture, family, politics. So then, how do I be safe? And in therapy, we set up the guidelines, the boundaries, so that projection can happen, so that silence becomes part of the invitation. You are the priority first. The client is the priority. That priority of the relationship between them and their symbol or symbols, their sandseam, that takes precedence over the therapist. So we remove ego, we set power aside that so many therapists are trained in to be in charge, to be in control, should be saying something, should be doing something. Instead, we set the boundaries of safety, your relationship, your priority with the elephant there. Yeah, with the giraffe. And for the clusters, then what is it that you want to know from them? What is it that they ask of you? Keeping that safe. How is that experience? So part of safety in narrative sand therapy is trusting that stories have been held because it hasn't been safe and continues not to be safe. Because once a story is shared, it can be degraded. So how do we work with those injunctions, with the devastations? We first honor that they exist, that the world is not a safe place, that people have betrayed us, that situations disempower. So first we work with empowering and honoring. And so we check with the existential identity, freedom. How has your freedom been restrained? It has been since you were a child. Everyone's freedom is restrained, but how do we respond to that powerlessness? Has there been anyone that's been trustworthy? A teacher, a family member, one person, the one person in life that said, I love you, I care about you, you can trust me, and you could. And all the times when you couldn't. So we know that we're dealing with tremendous grief and loss around connection, around the whole idea of attachment. Who do I trust? Who do I reveal who I am? And to really creating the safety, to come back to your main question, with work with symbols, means that integrity must be kept. Not the invasion of, the questions of curiosity from the therapist. These are great, but we have to shut up. We have to maintain that silence first to build the containment, not rush in with interpretation, not rush in and ask questions when there hasn't been anything mentioned about the turtle over there with the puppy on the side, the dragon. That's where we want to learn. So in narrative sand therapy, in my training, I take serious protection at a very permission to trust, permission to be creative in silence, to build a relationship with the symbols so that I can witness, so that I can encourage therapists to witness and empower therapists to be their strongest, most creative selves, their most trustworthy selves, to pull back from a great deal of training.
Yeah. I mean, I wonder, just as a kind of continuing question around that, is this discernment process you're going through in the therapist position around resonating with a symbol in terms of its cultural significance, in terms of its global significance, because I know you from my experience with you, you do have a a breadth of knowledge about symbols and their embeddedness in cultures around the world.
Yes.
How does that relate with interpretation? What's the difference there?
Great. Here we go with the layers of meaning. So what I ask therapists to do is study your tail off and to understand how rainbow or cow is meaningful in cultures globally. Not every culture, but a good variety. And then, so we study the myths, the symbols, the rituals, indigenous peoples across the globe. And so that research just isn't all at once. It's over the decades. Checking out our own internal meaning, our own love for a particular symbol. I love turtles. And so I have a fondness and a lot of projections around them. And then I go and study them, right? Just like you would with a rainbow. And really cultivating that and then hold it within. Because that richness, that, for me, the word kindness and tenderness are important here. To understand the meaning of giraffe. And so understanding where all the animals farm, wild, domestic, flight, sea life, those that live in the desert and in the mountains and in the snow. So we want to understand the landscapes of the planet we live on. What grows there? And what is the life of that type of tree, of that vegetation, of that fruit, of that, and then so flora and fauna. We build that. That's what gives us an ability to resonate. If I didn't know anything about a goldfish, I never looked up maybe a seagull, I wouldn't know. It lessens it makes my projections very narrow, my ability to comprehend and understand, not to interpret. So I really encourage therapists and graduate students. Let's give the word understanding. Let's rise it, bring it up. Let's platform it to a much more sacred space and take the word interpretation and send it off for an espresso. You see? Because interpretation is an invitation that the power resides within the therapist. Why would we do that?
Yeah.
And there's a place for that.
Yeah.
So my question is, why would we do that? We would do that in its place. There's place for interpretation. This is not the place. We seek to understand. And when we can, and that takes training, conditioning, to seek to understand. Even the curiosity of a trained therapist will be infused with interpretation. So it's becoming keenly mindfully aware of one's projections. And a great way to do that is to understand, who are the geese? Where do they come from? How do they raise their families? How do they sound? And so that enriches and makes me more aware, more conscious of my feelings, so I can hold them. At the same time, like Candace Pert has written, her research that we honor, molecules of emotion, that our stories and the emotions reside throughout the body. And if I can practice, this is where we come into counselor practice, the discipline of practicing, of taking a tree and a dragon, something from another culture, and then we study it, and we wonder about, well, how do I feel about it? Setting that. So all symbols are layered, and all sand scenes are layered. So the familial is always there. Culture is always there. The immediate social, cultural, political environment is always there. The unconscious is always there. The current situation that somebody, the stressful, whatever brings them into therapy, is usually the initial story. But the developmental moments are always there, which is why in narrative sand therapy, I really like to bring in not only existential, with the developmental. So how, if this turtle were to speak to your 7-year-old self, and you were to listen, and it brings a memory to you, somewhere around 6, 7, what story would turtle want to share with you? Keep that to yourself. This is exactly what I do in training. Keep that to yourself, to allow you to build a relationship, for you to find and to build your listening and trust skills, the empathy. Now, let's say turtle brought up a memory. You've worked to develop a relationship with turtle. This isn't cold. You've worked with that trust. Then the question is, how is that experience for you? Because as a therapist, from a narrative point of view and an existential phenomenological point of view, I want to know where you are experientially. Not what you said, not what turtle said right now.
Yeah.
But rather, where is it? In your gut? In your heart? Is there grief? Is there joy? Is there laughter? So the time you went to the fair and you got a big cotton candy and it was all over, and the laughter that came with that. And yet for the other 7-year-old, it was the time that grandma taught you how to sew, to crochet, or to dig in the garden, and to feel the dirt and to plant those bulbs, the richness of that. So here we bring in the gestalt. Here we bring in, how was that experience for you? The texture of the soil. So you don't repeat the whole story for interpretation.
Yeah.
But rather understanding, how was that experience? Where did you feel that? And so let's stay with the garden and the bulbs. And how was turtle with that? So I might go very slowly. What was turtle's experience? And you might say, I don't know. Go ahead and check it out. We're practicing the skill of projection through consciousness, through intentionality. And when that becomes safe, then it becomes safer.
Yeah, wow. So using that example, when symbol activation happens, what's going on in the brain, the client's brain? Because it's so fascinating. I mean, other therapeutic techniques might use the entry point as, oh, you verbally sharing that memory of, yeah, when I was 7, I was in the garden and grandma was teaching me how to plant a bulb. But this is different. This is it's almost seems to bypass part of what part of the brain in a way. What's going on there with symbol work?
So what we know so far, and at least what I've been able to accumulate, and of course there's always tons more out there, right? We keep our stories and memory stored in these channels. Think about little batteries in our brain, if you will, and those maintain memory. But as we grow, new neurons, the plasticity, which we're creating new neurons, some of those neuronal connections have to be borrowed or extend over to new stimulus. You're a teenager, you're a young adult, you're a parent in life, right? So when we are really stretching the brain and building more neurons, learning new things, we haven't lost some of those memories. They're still connected throughout the body, in the cells. And we know now that the heart has many neuronal connections, and that the gut, sometimes referred to as the first brain, yeah, because then this upstairs here developed. Yeah. So we actually have beautiful neuronal connections. The molecules of emotions, not only embedded, but neuronal connections. If we're going to tap into those, then it first of all has to be safe. It has to go through a process that doesn't come up against the injunctions. Don't think, don't feel, don't remember.
Yeah.
And don't be you. And so
Yeah.
to survive, we make conscious or unconscious decisions to stay in that authentic space. It's not safe. So this takes time. When a client comes into, say, talk therapy of some kind, straight talk therapy, cognitive therapy maybe, behavioral therapy, it's important so often to just get the story out. It's been held. And so clients need that time to share their story. We must be patient and not rush to the symbolic. We need to save the symbolic activity for when the client's ready. So we want to merge our psychodynamic, our existential and humanistic, our cognitive and neuroscience, neuropsychology. The narrative therapies that have been emerging, the social constructionist approaches, the behavioral approaches, how we change. So when somebody comes in with addiction, how appropriate to use cognitive and behavioral change. Their immediate need is to get out of what's been carved into the brain's cravings, the body's cravings. We take care of that first. Just like when medicine is needed to ground and stabilize someone who's rapidly deteriorating through schizophrenia, bipolar, severe depression. We take care of the emergencies first. And we stabilize and ground, and it isn't until then. But to return to what's going on in the brain, we think about that in terms of the client, but it's happening in the therapist. If it's not, then it's problematic. What I want to do is to bring therapists into a real attunement to what's firing in their brain and emotions and in their body. Yeah. And it really goes back to the traditions of the body that we've known about for many, many decades, 40s and 50s and 60s. It's just going right back to grounding in the body. We've always known that the lived experiences in the body. So why would we focus just on the head? We've always known that therapy is grounded in projection. Why would we dismiss that?
Yeah.
So we need to understand how we work with projections, how we work and how we are able to resonate and maintain, to contain, to be witness rather than objectify. I fear that too much therapy has objectified this process, where the client becomes an object, rather than bringing them in and collaborating in a meaningful process. And so I really love what existential philosophy, existential psychotherapy has gifted us with.
Yeah.
And so we want to honor. And the brain is being activated, to cut to the chase. A little too late to cut to the chase, but to cut to the chase. The brain and the body are always present. The brain and the body are always being activated. The neuronal pathways and the junctions of the therapist are present.
Yeah.
Until we become aware and give therapists permission and protection to really open up to the injunctions that they bring in, the fear.
Yeah.
To honor the integrity of the clinician. We are not free to be fully present to what's happening in the brain and the body. So there's four, but there's three immediate presence. The brain and the body and the culture of the individual client, the brain and the body and the culture and the training that is the therapist, and then all those projections onto that which is symbolic. And by the way, the symbolic could be drawing, clay figures, miniatures, household items. And just as a quick, I ask therapists to walk through their house. Here's a suggestion. Walk through your house. Go into your bathroom every day and pick up something or look at something and notice it. Stop and look at the corner of the bathroom, a part of the shower, the sink that you've never looked at and study it. Give it voice. Ask it how it's doing. Go into the kitchen, picking up any utensils. I like a canoper, for example. Isn't it? But the utensils are fabulous. And picking up two and having a conversation. What would the spatula say to the spoon? What do they know about you? What stories might they hold? If we can practice this, going into your study, now, going into your library and picking up a book, any book. But this time, imagine a page in that book was written just for you. It doesn't matter what page. Open it up and read a paragraph, read a sentence. Stay right there. What might be the meaning of this sentence, this paragraph for you today? Could be a book of poems or an academic book, doesn't matter. So finding ways for therapists to become imaginative, more creative, and as Thomas Ogden would suggest, innovation in the moment, being so present that we don't have to bring in techniques. What was that approach? What was that theory? What does this mean? How do I interpret this? Stop it. Let's set this aside and be so fully present, so immediate, to be able to resonate. It's a practice. Then you can walk in the grocery store, the dentist office, and take a look around. And while they're cutting your hair or you're at the checkout counter, building the imagination. When that checkout counter person is bagging, of course, not saying anything, but imagining. Instead of drifting, just what is a story that you imagine from their childhood? If you were to give them anything that they could inherit to lift them, what would that be? So we develop a way of being so present, but then take naps, go plank, because these are just exercises to build up the ability to resonate, to be safe, and to empower others, to be so mindful of the self, and to never stop trying.
So what you're saying is that practice in everyday life, engaging with the symbols, it's building the therapist's readiness to resonate in session then.
Yeah. Because if you can imagine the life story of the dental hygienist that's cleaning your teeth while they're cleaning, if you can imagine that, you have more capacity to imagine what the tree or the pony. You're practicing storytelling in your brain. And that's counter to your training in graduate school and supervision, which is to, listen to, of course we're listening to the story, but narrative means layering, the existential meaning, freedom, connection, mortality, all of that is always present in therapy. What are we focusing on? When is it appropriate to explore? On the continuum of freedom versus the freedom that's been stolen from you. Children know when their freedom is taken away, and they make plans about that. Adolescents keenly feel identity that's been distorted or framed, regimented. Their freedom's been taken away, and they feel that very deeply, not necessarily always consciously. So that is their job. Adolescents' job is to push against the river to figure out identity and freedom and connection. Everything is based on that. What was the past and my connection and letting go of those who raised and whose beliefs and values I now sort out. What in the adolescence, what am I supposed to be in life? And your group process, working with adolescent 18 to 30-year-olds, such a pivotal time in life. This is who I thought I was. This is where I fought for. Now who am I? Now, And how do we discern those expectations from our own truth? Who am I?
Mm-hmm.
Where am I going? What is my meaning in life? And that changes from decade to decade to decade.
And the relationship with the symbols is woven with these existential spectrum.
It is.
Yeah.
Yeah. So it's connection, disconnection. It's freedom, lack of freedom, right? It's identity and the stealing identity. Yeah. It's meaning, deep meaning, authentic meaning versus just moving through, doing what I'm told, some rote activity, not finding meaning and purpose. We live, we survive because there's hope, and hope grows out of those bulbs of meaning. Somebody rips those bulbs out of the garden, there's emptiness, there's suicide, there's depression, there's despair, and there's all the acting out onto others. It's not grandiose to think that we have war because those bulbs have been damaged. We blow them up. War in intimate relationships, in families, and in communities, in full nations, and in the world. And so that's all trauma. So we can't ignore the existential, but we get there. And the symbols can help us with that. And revalidate. My job is to validate therapists.
Yeah.
You, as a therapist, and our therapists who are listening, your job is to validate, to empower, to give permission to break through the injunctions that have distorted and stolen purpose and meaning and identity. What more is there? You want to talk about addiction? You want to talk about any depression? Any adolescent acting out? Anybody in midlife struggling? The elders? You want to talk about the 2-year-old? Doesn't matter. It's all there in the expression of pain, the expression of loss, the expression of grief, and the struggle through who am I? Why was I brought into this world? Where is it safe for me to function? Who can I trust and connect with? Those are always important questions. And we must deal with those from an authentic, safe place, doing our own immersive process. To make an I statement here is that we must immerse in our own work to develop the skills of authenticity, what Rogers suggested, deep empathy and compassion without burning out.
Yeah. Thank you so much. And, you know, I want to continue this conversation, but just for the sake of time, are there any last things you want to share about symbols today, just to kind of wrap up our conversation?
There are so much more. We'll do more in this, but I think I would invite, pardon me, I would invite all of you to consider that symbols are the third presence in your life that have been there, from the teddy bear to the sacred to the mundane. The symbols have always been there for you, waiting to hear your story, waiting for your voice, and waiting to tell you their stories. And so, let's do that. Taking good care. Thank you so much for being here with symbols, and we'll continue this conversation next time. Take good care.